I started out working at part-time for the people in the laundry. And in '73, they come along and they was going to run the nurse's aid course. And I asked Ms. Chitwood if I could take it.
Well, I came to E-Town in 1966, and I was the second internist that had ever come to this town.
I spent 20 years in the United States Army, and then I had a job opportunity at Hardin Memorial, and so I started working there in October of 1992.
It was always a pleasure for me to get up and go to Hardin. When they needed a strong body and a weak mind, they said, get Withrow, she'll come.
I graduated probably on about May the 14th, 1967, and I started working at Hardin Memorial Hospital very proudly, I might say, on May the 17th.
I came to Hardin, and so I was hired on, and I started on the 311 shift, and that was for surgical patients.
I worked there 33 years. I was a registered nurse, and I worked in the emergency department, in recovery room, and in cardiovascular services.
Hardin Memorial is the crown jewel of Hardin County. They are a facility that provides state-of-the-art health care for not only the citizens of Hardin County, but our 10 surrounding counties. They've been doing that since 1954.
If you were going to build a factory in E-Town, you'd want to know that all your employees were going to have the opportunity for good health care.
We have grown. It was just a little square box when I went there, and it just gradually grew. But have you ever heard of the expression, it didn't outgrow its britches? It stayed intimate.
It's sort of like a family taking care of patients.
I miss the people. You make lifelong friendships working with people in those situations. People that I worked with, that you know somebody has your back always.
If you have a good community, you need good health care. So it's a key part of the community.
I don't know how many people would tell me how much it meant at a later stage that there was a face there that they recognized to actually be there with them when they went to sleep.
But I always come 1 hour early and visited my patients, talked with them. I could talk to them when I wouldn't have the time after I went on duty.
By the grace of God, this could be you. Could be your mother, your husband, your child. So remember that these are true people here.
And I'm so excited that the foundation is up and running now, because I believe that they will carry this legacy, tell our wonderful story, and carry this forward into the next time frame.
I think the foundation can do wonderful things by buying equipment, doing things for the hospital.
Because of the fact that hospitals have a thin line of profit, and sometimes they have a loss, they need some financial reinforcements in the background. If citizens don't contribute to them when they're able to, then they will not be able to keep up.
The vision that the founders had of providing that quality health care for our citizens in the community is absolutely essential, not just now, but in the future. I want it to be available for my kids and grandkids and the citizens in the future.
That was a big vision at that time. for the people in the community that wanted the hospital there, and to look back now, and if they could see how much it has grown, how big it is, how many people it serves, all the services that it serves, if they could come back, they would go, wow.